And then we'll give it another minute and I'll admit some and then we'll get started. I don't know how long we'll be out, but all right, let's go ahead and get started. Thank you everyone for coming today. My name is Michael Sizemore. I'm the advocacy manager here at SAARA. And we're just going to break down our 2025 General Assembly legislative outcomes. At any point, if anybody has a question, comment, concern, prayer request, raise your hand and we'll address it. This is pretty much a community gathering, and you know, gotten anything to say or anything like that, go ahead and come on. But again, thank y'all all for being here today. All right. So it was a short session this year. We had a handful of priorities, but you kind of don't want to go put every single issue idea out there just because limited time, and short sessions are, you open up and you sprint to the finish line. Uh, and I need to So our biggest priorities this year were uh, barrier crimes reform, opioid treatment programs, opioid antagonist legislation, recovery residencies, and Medicaid reimbursement rates, which is always going to be a thing perpetually in the Commonwealth. Our first one, we had Delegate Katrina Carlson from Charlottesville go with some barrier crimes reform. And this has been, we had a law last year with barrier crimes, open up a little, aspects for the future, but, it's baby steps. This year, she added the section where we're going to allow certified, hang on, I'm letting some people in. Certified peer recovery specialists. And the thing that's let them down in the past, if someone who is a PRS has outstanding fines, fees, restitution, even if they go to the DBHTS, if they go to a CUSB, Department of Health, even community health organizations, they're certified. They've been in recovery. They interview. They get offered a position, and then they go to HR to sign the papers, and they run their background, and they see that even though they're paying their restitution, they're still on restitution payments for the next few years, next few months. And so you're in it's an instance you're hired and fired just because it was Commonwealth law that if you have any payments, any unpaid, any restitution, you're not allowed to accept that position, let alone certain places apply, even though you're more than qualified. And I know a lot of these instances, somebody can have incredible doctorate degrees, masters, and whatnot, and really do a lot to help those who in active recovery. But the beauty and the proven data on the effectiveness of peers is they have a shared lived experience with the folks they'll be talking to. So this one passed and it's been signed into law. And we're going to look at the next steps, the next baby steps of barrier crimes reform coming in the next year's session. And we'll kind of at the end we'll go in to the where do we go from here. So the next one, opioid treatment programs. The goal was to expand opioid treatment to mobile units across Virginia, specifically for those who are homebound or without treatment or transportation. The biggest bill was Senator Barbara Favola, opioid treatment programs, dispensing medications through mobile units. And that, goes to folks a lot of times in rural Virginia where, again, they're homebound. They don't have, public transit. They can't go down the block, get on the bus, and go to, to their doctor or a treatment facility. So they're going to be less. The odds that they're going to get the treatment they need to stay clean and to be in recovery are hardly just very limited. And you see a lot data proven that folks will, without that, will fall back and they'll have they'll fall off the wagon, so to speak, and they'll not their own doing, but again they're left out to dry, so to speak. So this is advancing resources to have mobile units where they can go to directly to the consumer or to the folks who are in need of that opioid treatment, or they can set up maybe in the town square. They'll have publications coming out talking about we're going to be here, City Hall. We're going to be here at this church, and allow more people to get access to their opioid treatments. In a lot of cases, they'll be able to go on site and door to door to folks who are in need of that. So that was a pretty big victory for us this year. And again, we had a couple different bills in the House and the Senate that did the same thing. This one, not just we passed and it was signed into law for more resources for mobile units, and this one took it a step further to make sure they had broadband access for those mobile units. And again, you're talking about folks out in rural places where you don't have good cell phone service. They don't have incredible access to their technology to link up. So this is going to give them the resources so they can be plugged into all the data they would need to administer opioid treatment, look through patient files, anything that they can dispatch back to any doctor, maybe in Richmond or in their heads, where if they've got questions on how to address this individual who's needing that medication and that treatment, they have any questions, if they don't have broadband or Wi-Fi access, it's just hit or miss. This way they'll be in constant communications and be able to access other doctors or anyone who's be able to double check and make sure they get the most effective treatment for that. Another has been, this is something that we've been going over for a couple sessions, and that's opioid antagonists. And that's pretty much everybody knows the name brand Narcan. This is naloxone, and this is going to be able to expand access to acquire naloxone at your office and have folks trained to administer in the event of an overdose. And it's been limited but expanding for different businesses and publics. But this one takes it, a dozen steps further. So now more public offices, every public office, be it statewide, federal, local, and a lot more private sector businesses now will have access to more quantities of naloxone, Narcan, as well as the training for staffers to be able to administer in the case of an overdose. And that one passed. You know, Delegate Patrick Hope has been incredible on this over the years. He's been kind of the lead. He's got a lot of opioid antagonist bills, and he's been a really big advocate for the recovery community. And this one passed unanimously, signed into law. And again, I don't think I've mentioned it yet, but everything that's passed and signed into law goes to effect July 1st. So there's going to be a lot of good things happening for the recovery community at that point. We had a handful of things for recovery residences. And one of the goals was to increase the number of recovery residences, the protocols to make them more effective in housing and those with substance use disorder. Delegate Holly Seabold had a bill for a state plan for Medicaid assistance services in recovery residences. There was work groups. There was going to be a lot of studies to get resources, get more folks. I spoke with her before, we went and endorsed the bill. And one of her things was we want to have resources to get people trained and accessible, medical folks, folks who could be active. There's, peers. There's other folks who could be there with the folks who are in active addiction or suffering from substance use disorder. It ended up being passed by to make it just a study. So it's not dead, but, it's not going to get the resources. It's not going to go into, full front. They'll enact a study and bring it back next year. Senator Schuyler Van Valkenburg also had a recovery residence bill with certification requirements for those who are in charge and administering every kind of rule, regulation, yada, yada at recovery residencies. That was passed and signed into law. So, mixed results for recovery residencies this year, but on the all, I guess we can feel okay with the results. But again, it's we're going to have the changing of the guard because this is an election year, and this is something we're going to study and come back with all the advocates, the whole community, reaching out to legislators to see where we can go to further recovery residences. Medicaid reimbursement rates has been and is and possibly always will be a part of our advocacy and what we look to get done at the General Assembly. The goal was making Medicaid more affordable for those who rely on it as their primary health care, which in the events, data proven, a lot of folks who are, suffering from substance use disorder and are in recovery, a lot of times, they don't have full salary positions. They don't have healthcare benefits that, they can go in and, chunk out a little copay and get everything they need. And so they're a lot of times on Medicaid. One of the biggest bills we had was Delegate Lauren Cohen, and it was a DMAS application for Medicaid or medical assistance eligibility for Medicaid Works, which is a large, expansive program allowing more folks to access Medicaid, and what they're paying when they go in for treatment, they're getting reimbursed. So they're not kind of keeping their head under financial water. And there's going to be a lot more folks who are going to get reimbursed for that, seeking active treatment. So that's a giant win for those in recovery. We also had two of the big shots on some of the biggest committees. Delegate Luke Torian and Senator Louise Lucas successfully increased by 10% Medicaid reimbursement from all the budget bills this year. And that was another win. We signed it. Youngkin signed that into law. Another thing was prescription drug affordability. And one of the biggest advocates and allies for recovery has been Delegate Mark Sickles. And he put, the goal was to require pharmacy services, administrative organizations to submit information on reimbursement rates and fees, ultimately to make drug prices more affordable for the consumer. So you're able to say it's public, it's transparent, that if you go, you're shopping your pharmacy, be it a CVS, a Walgreens, or a local pharmacist, you can see, all right, this prescription that I'm going to need for recovery from opioid addiction. This drug, I can see, goodness, it's going to cost $280 at CVS, and I can see that their overhead charge is astronomical. They're just profiting off me. Go to a local shop, go to another Walgreens or a local pharmacy, and you can see you can kind of price shop, and this is going to really make a good difference for folks who are um, relying on drug treatment, therapy, and medicated treatment. So they'll be able to get prescribed and get on whatever regimen of medication their doctor is put them on, and not drown in overhead fees and pharmaceutical, big pharma price hikes and whatnot. So that's a really good step towards uh, recovery for the recovery and addiction community. And again, that was Delegate Mark Sickles. He had several bills this year, and he's being chair of a big committee. He's always put recovery first and foremost. He makes sure we're heard loud and clear. He asks the questions to bill providers, and he puts us at the forefront. He's been one of the biggest allies that any organization could think of. So moving forward, um, again, the beauty of living in Virginia is we're the only state that has an election every year. Um, and as everyone knows, it's not just the president. Things we need our local and state government. So this year, the House of Delegates is up for reelection. We're going to be looking at those who are coming back, those who are running for close contested races. Look at what they're proposing. Look at what they're campaigning on, and since they're citizen legislators, reach out to them. You can go on LIS, you can go a plus, you can Google them because they got regular jobs, and call them, get a sit down with them, talk about what you're specifically looking for to come into law at the 2026 session, or why they really deserve your vote, because you pay, they're your employees. So it's really vital to reach out to those who are running, the new candidates, and then the folks that the recovery community has relied on over the years. Just making sure that they know you still got their support, just so as long as they're staying on the things that we need. And the governor's race, it was just announced we officially have two primary candidates for the Democrats and Republicans. They got the signatures. So we have on the Republican side, the Lieutenant Governor, Winsome Sears, and Democratic side, Abigail Spanberger. We're not here to endorse. We're not here to politicize. We're not out here to campaign. But Abigail Spanberger has been a great ally of the recovery community. And we're going to be looking at ways to talk to both candidates and, merging everyone who's in this room, talk to everyone you work with, family, friends, cousins, church mates, coaches on t-ball teams and whatnot, and get out and ask the questions to both candidates. Every candidate for the House, every gubernatorial candidate, there's going to be campaign stops. There's going to be community events. There's going to be a lot going on. Just be active if we want to keep, we had some wins this year, and we had some not so much setbacks, but just things that got put in hold. And I was talking about the Berry crimes bill earlier. It's baby steps, and a lot of these issues and these priorities are baby steps. You gotta, um, you can't, shoot for the moon on every piece of legislation because there's going to be people from different parties. There's going to be a governor with budget priorities, and you can't come in with a bill that you support. It's kind of like Texas Hold'em. Like you get dealt a pair of fives, and then you can't go all in thinking because you got a good hand because you don't know what they've got and what their priorities are. So baby steps on a lot of these things. So get out, talk to your delegates, your representatives, um, see where they're at, and make sure that they know you're out there, you're watching, and if they want their vote, if they want your vote or the whole organization to get behind them and um, be active, then let them know. So, any questions, comments, concerns, prayer requests? Where are we at, everybody?
Well, thank you, Mike, for a really great wrap up of a really interesting session. Just it being a short session and the problems we had with the delay. I know there was a lot of wonkiness going on, especially with all the cuts that we're seeing. So appreciate you keeping your finger on, uh, keeping your finger on what's going on. And I think you're right. We played the best hand we could. We tried to move forward where we could find some common ground and protect the things that we fought for collectively over the last couple of years. I think what Mike has outlined and what we're seeing with the upcoming election will be potentially a very different perspective we on how resources will be, I think, deployed into the community, from the federal cuts to really when that budget passes, to how that really impacts agencies like DBHDS, which we've seen since session ended in this meeting right here. We've seen DBHDS unfortunately have to cancel contracts due to cuts from SAMHSA. So those are things that in the in between time that SAARA will continue to track and share information about for prospective parties, but also start to, what does next year look like? And open up moments for engagement from all of our partners and folks who follow SAARA to really, raise the flag on what they think we should be focusing on.
Absolutely, because even though session's over or concluded, the work really never stops. We don't really take a pause. And I see Tina asked the question, are there particular legislators that we suggest we can reach out to educate outside of session? Honestly, whoever your home representative, your delegate, or senators, always reach out to them. But the big ones, and the chairs of these committees where we get a lot of our recovery bills put through, um, courts of justice, which is the chair is Delegate Patrick Hope. He's been a great ally for us, and he's always willing and able to, write new bills or put addendums and put budget items. And I'm gonna first off, this is gonna be I just put in the chat. This is the list of every committee in the House, and there's contact lists for the chair. Um, you know, those who worked at the office and the delegates and whatnot. So, uh, and the other one of the other chairs I spoke about Delegate Mark Sickles, and he's chair of House and Health Human Services. Tina, he's a really good one to reach out to. Go down. Those are probably the two, and correct me if I'm wrong, Vic. Those are probably the two biggest chairs that we want to reach out to if we want to educate and talk about coming up on this coming session. But
Yeah, yeah. What Mike said is absolutely correct. One, you want to immediately reach out, use that tool that Kate dropped in the chat, reach out to your representatives because they are more willing to listen to people who vote, who are potential voters in their district. And so the first thing you say is, hey, delegate, senator, so and so, my name is X, Y, and Z, and I'm a constituent of yours. And that really frames the conversation. And I'd love to educate you on an issue that's important to me. I think that's the first step. And then, as Mike laid out, is looking at these committees, both on the House and Senate side. The membership may change. Leadership of those committees may change after, particularly in the House of Delegates, after elections. So I think anyone who's on the committee currently, you want to find an opportunity to reach out to, and we can do a follow up with maybe those contact information for those committee members on those committees that you outlined.
Yeah, those are the big guns, but
And then
anyone that represents you.
just really quickly,
Yeah,
I'll
go ahead.
also add that this coming year will be, if I'm not mistaken, it will be a budget year, right? Because we're on the second year. So Virginia operates on a biennial budget. First year it's created, second year is amended. So going into not only this election, but the end of this year, there will be a new state budget presented. And that comes from the governor. So we won't know who that is for quite some time, but start thinking about, at least we will be starting to think about ways to advocate and, ensure that services are not cut significantly. We obviously know there will be some type of impact across the board, but we need to make sure we speak out so that services, that we don't move backwards. Um, Over the last couple of years, we've seen a decrease in overdose death rates, but a lot of that has been due to the explosion of resources, Narcan, more individuals being able to qualify for Medicaid, um, the utilization of ARPA dollars to be able to really tackle, um, you know, communities that have been overlooked, like Southwest Virginia. ARPA dollars have paid for the regional peers staffed by DBHDS. So those type of things we know will be impacted, and we have to ensure that we hold steady and we move forward.
And there was a question, any talk on why the expungement law was postponed in January or to January 1st, 2026? I don't have enough. I can't really give you a clear answer on that. Maybe Vic could help or anybody else who knows about that. But
H. Crawford, are you asking why it was postponed for enactment or postponed to be taken up in the next session?
Well, it was supposed to come into effect July 1st, but it was postponed to January the 1st. It's the clean slate law. So I just wondered like why it was postponed, and what I guess it was enacted in 2021. I think that's the way they understand it. So I just wonder, like, it was supposed to be coming into effect July the 1st, and now it's been pushed out, and we've waited for this long for it. So like, was there any talk as to why that was pushed out, and like what are the hopes of it actually being like in January 1st, it's not going to get pushed out again?
That's a great question. What we can do is we can follow up with you offline for a clearer answer. I'm not 100% sure at this moment, but I do know sometimes for political reasons, things are pushed back, or the enactment of things are pushed back for various reasons. One, they don't have the mechanics and process in place to actually process the expungements, at that volume. There may be some political reasons. Not 100% sure, but we can definitely follow up with you offline with a clearer answer once we do a little bit more research.
I just didn't know
yeah,
if maybe it was something that had been talked about that you would have, but I would be interested to know like what you guys think about that offline. So thank you.
Of
that's
course.
a good question, and that gives us a little bit of homework. That's going to help us, put a quiver or an arrow in our quiver. So yeah, thank you. We're gonna look in that and get back to you, and
I appreciate that. Thank you.
that's
Because
gonna
I
help
know that
us along the way.
I have people that are waiting for this, and so like then when it's like they get excited because July 1st right around the corner, and then now it's been pushed back again. So anyway, thank you.
Of course, yeah. Thank you for asking that one. That's a good one. Anyone else? Questions, comments?
Not really a question, but a comment. So thank you for the presentation and all the work that you're doing, specifically for those humans that have substance use disorders. So I just want to say thank you guys so much. And obviously, McShen, we have a ton of political capital. So just let me know if you guys need anything to moving forward, because we're going to be doing, well, we're going to have to do our own work in the General Assembly this next session ourselves. Yeah.
Of course, we always got each other's backs, and it's been a really good community partner at Mission. So it's always interested with the governor's election and the changing of the guard to get your priorities and whatnot. And the other thing, like Vic was saying, because it's going to be a budget year, it may come down to the fact, because we don't know who's going to be governor yet. It may come down to the fact that some of you would have to do almost an in-house audit to see where you might need other funds that can be, budget distributions, budget amendments, line item amendments, just to keep your heads above water before everything, starts with the new governor's budget, which Vic said we're not going to know until after November and the start of the year. So anyone else? Well, that being said, yeah, and you see that Kate put the Find My Legislator in the chat. So, again, we urge you to reach out to your legislators, not just the ones who are, the big ones on the big committee chairs, but every one of the folks that represent you, even if they're not for reelection, or even if it's an open seat, or if they're don't have an opponent, reach out to them, talk to them, and Kate with the find your legislator over there. At any time you ever have questions, if you want to be involved with anything we're doing, please feel free to reach out to me, Michael S. at SAARA.org or SAARA.org, and you can find any of our contacts there. Thank you, everyone, for showing up. I hope, I can see you in the future. We'll go about this side to side, and in the end, we got this. So thank you all.